Hello students, welcome to today's class. Today we will be trying to understand the significance of health psychology as a discipline within psychology. Now first let us go over the background of health psychology very briefly. As we know, health psychology was accepted as a specific area or discipline within psychology in the year 1978. And it was accepted as the Division 38 or the 38th Division of Psychology by the American Psychological Association. Further, we also know that in the year 1979, three famous researchers, Cohen, Adler and Stone, put forward their book Health Psychology. It was titled Health Psychology and it put forward a very influential and far-reaching view of what health psychology could do for the society. A third major landmark in the history of health psychology was the official publication of the Health Psychology Journal in the year 1982. Now, thus we know three major events in health psychology: when it developed, the first book on health psychology when it was published, and when the first journal of health psychology came out. As I have mentioned before, today in this class we will be dealing with the significance of health psychology. Now the entire significance of this branch of psychology is in fact contained in the definition put forward by Matarazzo, and we will be following this definition in this class and analyzing different aspects of the definition, and in the process understanding what kind of significant role health psychology can play in our lives. So coming to the definition by Matarazzo. Matarazzo defines health psychology as the aggregate of the special, educational, scientific and professional contributions of the field of psychology to the promotion and maintenance of health, the prevention and treatment of illness, the identification of etiologic and diagnostic correlates of health, illness and related dysfunction, and to the analysis and improvement of the healthcare system and health policy formulation. So this, as you know, is a very big definition, and now what we are going to do is to break this definition into small parts and see through these parts what kind of significant role health psychology plays. Firstly, we know that health psychology deals with physical health and not with mental health. Earlier, the field of psychology had its preoccupation with dealing with mental health disorders. Whenever we used to think about psychology, we also used to think about mental illnesses and disorders. Now in health psychology, we see a significant shift from the focus on mental disorders to a focus on physical ill health and disease. And this significant shift is one of the primary significant features of health psychology. Secondly, as the definition says, health psychology promotes the maintenance of health and well-being. Whenever we think of health, we always think in terms of diseases or disorders. Health comes into consideration only when we want to reduce some kind of disease or when we want to treat some kind of disease. Now, health psychology totally changes this notion of looking at health. According to health psychology, the concern of health should not only be limited to those occasions when you have some kind of disease, but your concern of health should be there in your day-to-day lives. And this concern should be towards promoting your health, towards enhancing your health and preventing any kind of disease or preventing yourself from falling sick. So this promotion of health is another significant feature that health psychology puts forward in its discipline. Further, health psychology also does a lot to promote health and well-being. It identifies certain behaviors and certain lifestyle factors which are most relevant to ill health. For instance, research has proved that increased aggression and hostility can lead to cardiovascular disorders. Similarly, research has also proved that certain lifestyles, for instance, the absence of dietary regulations, taking high-calorie diets, or using unprescribed drugs or medications, self-prescribed medications, can all act as lifestyle factors which can promote disease. Now, what health psychology does is to put forward literature and researches which document how different behaviors and different lifestyles can promote ill health. It also puts forward as to how these lifestyles are caused. For instance, it may be a general habit of the person and the person cannot get out of the lifestyle because of his moods, because of his lack of willpower, that actually he will be able to adopt a more healthier lifestyle, or just because he doesn't care. Or the unhealthy lifestyle may be a result of certain stressful factors, and to deal with the stress, he ignores positive health practices such as exercise or a healthy diet. Now, by putting forward all these possible causes which can impair health and the causal factors that lead to these causes, health psychology tries to sensitize individuals towards promoting health. Thus, what health psychology basically does is preventing illness. And health psychology's focus on preventing illness has had a lot of social benefits. For instance, it has led to a population which has a greater level of health and well-being. And secondly, it has also cut down the costs spent on healthcare, the costs spent on medical and other sources of treatment once the disorder occurs. Now, if we see the other part of the definition, we see that health psychology plays a role in the treatment of physical disorders. Now, as you know, the process of treatment consists of a number of processes. For instance, a compliance to medical advice, a following of medical regimens, an acceptance of the medical interventions, and most primarily a seeking of medical help, which can all influence the process of treatment and recovery from illness. Now, health psychology realizes that a number of behaviors, attitudes, and cognitive factors are involved in the compliance to medical treatment, in the acceptance of medical treatment, and in the seeking of medical help. So, what health psychology significantly does is to underline the different kinds of behaviors that are involved in these functions and those factors which may prevent the successful acceptance of treatment and create obstacles in the road to recovery. Now, a single most important problem in treatment is the compliance to medical care. Once a person seeks medical help, he will be prescribed certain medical regimens or dietary changes or medications, but research shows that 93% of people do not actually comply to the medical recommendations and diagnostic requirements. They may not take the prescribed pills, they may not engage in regular exercises, or they may not make necessary dietary changes. So, in such a circumstance, health psychology with a focus on people's health behaviors plays an important role in understanding, evaluating, and influencing behaviors in such a way that there is increased compliance and increased effectiveness of the treatments provided. Fourthly, we see that the definition of health psychology states that health psychology is concerned with the etiologic and diagnostic correlates of health, illness, and disease. Now, first we will see what is etiology. Etiology refers to the origin or causes of disease, and when we describe etiology, we describe the causal factors for a particular disease or illness. Now, initially, with the biomedical model of disease, what was believed was that all kinds of disease had some kind of biological causation or were caused due to some kind of biological pathology. What health psychology has done is to change this view of health disorders. It has changed the view from the biomedical model to the biopsychological model, and from the biopsychological model to a biopsychosocial model, which in other words means that the study of health psychology has put forward that causal factors for diseases, whether they are physical or whether they are mental, are not just limited to biological correlates. They may actually be caused by a host of psychological and social factors. For instance, we ourselves see in our day-to-day lives and around us that psychosocial factors such as stress can create a number of physical distresses and physical disorders, say for example migraine headaches, cluster headaches, cardiovascular disorders, and other related ailments. Now, another area where health psychology plays a very important role is the process of diagnosis. Now, we know that any disease begins with a lot of symptoms. Say for example, a person is showing symptoms such as headache, nausea and vomiting early in the mornings, reeling sensation, fatigue, and a loss of coordination in motor activities. Now, there may be a lot of reasons for this. Although the symptoms are the same, a disease may be as simple as spondylitis, or it may be as severe as a brain tumor. Now, what diagnosis does is to identify this disease or cause behind the cluster of symptoms that we see. Now, there are a number of processes in diagnosis which may be affected by a host of psychological, emotional and behavioral factors. For instance, many forms of diagnosis involve invasive clinical procedures and regimens which the persons may fear and may show a lot of anxiety about. Also, the doctor-patient communication may break down due to various factors and due to the medical surroundings and the patient's apprehension regarding these surroundings and the defensiveness that he develops. Now, all these factors can actually lead to a lot of problems in the process of diagnosis. And hence, here health psychologists with their base of research and with their practice have a lot to contribute. For instance, they may teach doctors, nurses and other medical professionals better ways of communicating with the patient, understanding and empathizing with their problems and their emotions in the medical situation. Now, there are two premises which we'll be dealing with here. One is the patient-centered approach in diagnosis and treatment, and the other is the doctor-centered approach in diagnosis and treatment. In the doctor-centered approach of diagnosis and treatment, the doctor has the major role. The patient is mainly passive and he answers questions put forward by the doctor and he undergoes the procedures the doctor tells him to do, and finally he is given a medical treatment or regimen to follow. And the patient has a little say in the total scheme of things. Now, this may be preferred to a large extent by the older generation, but with recent times, most patients prefer a patient-centered approach, where the doctor discusses with them their entire range of problems, where they can decide how to go about the diagnosis, where they have a say in what kind of medical procedures they are going to undergo, where they get to understand what is the purpose of the various medical regimens they are going to undertake and what course of treatment will be there, and they have a choice in the entire scheme of things. So the medical treatment in fact becomes a cooperative action between the doctor and the patient. Health psychology significantly supports this patient-centered approach because such an approach will help to increase compliance towards medical treatments and will lead to greater well-being. And in those areas where doctors, nurses and other medical professionals cannot actually handle the whole task of understanding patient concerns in a medical situation, the health psychologist can effectively step in. They can actually counsel the patients to better approach the medical situation and better handle medical procedures. For instance, we may have often seen that before undergoing a major surgery such as a cardiovascular surgery or a brain surgery, the psychologist in the hospital often approaches the patient and discusses with him his queries, his needs, his fears and what he expects from the surgery so that it can give him a sense of ease and also aid post-operative recovery. Now, another significant role that health psychology plays is understanding the significance of the effects of disease. Now, when a person is diagnosed with the disease, it actually puts a big question mark on his self-esteem, on his current status, both physical and emotional, as well as his future. There are a host of problems that accompany the diagnosis of a disease. Firstly, he has to go ahead and seek appropriate future medical care. There is the concern of medical costs and expenses. He may not be able to continue with his occupational work, at least in the way he used to do. There are medical bills to take care of. There are people close to him to take care of. He must seek assistance at a home or a hospital, and totally it leads to a loss of self-esteem and self-worth and may lead to a lot of depression and anxiety. Now, what health psychology significantly does is to understand this kind of psychological and emotional correlates of illness and disease for the person and helping him gain a higher sense of well-being and a better ability to cope with the situation that disease comprises. persons suffering from chronic illness have a near doubling up of the same problem, because they not only have to suffer the disease, but they have to suffer it for longer periods of time. And it is not only the individual who is affected, but also his caregivers, family and immediate others, who have to understand the prospect of having a person who is extremely sick at home, and that too for a long time. So it leads to a lot of psychological and emotional disturbance, both for the sick person as also for his caregivers. And this is where health psychologists step in to increase mental and psychological well-being of all the persons related to the disease, both the patient and those around him, so that they can better cope with the situation and better proceed on the road to recovery. Now, a tricky situation faced by health psychologists is in the case of persons suffering from terminal illness or persons whose death is imminent. So what do health psychologists do? They actually focus on improving the quality of life or whatever life is remaining with the person, so that he feels maximum amount of well-being in those last days and is better prepared to approach whatever awaits him. Also, it involves making the caregivers and family members and others close to him more ready to face the inevitable situation and more ready to cope with grief and bereavement once the person has died. Now, another significant area where health psychologists play an important role is in the management of pain. As we know, pain is an all-important aspect of our life, and pain actually decreases the quality of life to a great extent. None of us can tolerate pain for a prolonged period of time, and our entire efforts are directed towards reducing pain. However, disease and illness do often have the pain component, and it may not be possible to actually control it or eliminate it as quickly. And this is where health psychologists come in to understand the psychological, emotional and behavioral correlates of pain and how pain is affecting the patient as an individual. It also deals with a number of pain anomalies such as phantom limb pain or neuralgia. Although the measurement and understanding of pain is difficult, health psychologists may use a number of techniques, for instance questionnaires like the McGill Pain Questionnaire. And they may also go in for a number of therapeutic procedures such as patient-administered analgesia, or where the patient himself tries to reduce the pain through thought processes, cognitive behavioral therapies, through biofeedback mechanisms and other techniques for reducing pain. Now we come to yet another significant aspect of health psychology, that is the conducting of research. As we know, for any field to progress, research and periodic advancement of knowledge is extremely essential. And health psychologists are better placed than other medical care practitioners to conduct research, because they have with them a repertoire or a host of empirical and statistical skills and knowledge as to how research is to be conducted. So they can both be individual researchers as also conduct collaborative research or provide expert advice to other medical care professionals when needed. Now, they may deal with a host of research questions. For example, a research question may be that what are the factors that prevent healthy diet, and how can we encourage people to engage in more healthy eating habits? Or the research question may be preventive in nature. For instance, what are the factors that prevent people from going on and getting themselves immunized or going for regular health checkups, and how can we improve this kind of health responses? Or these research questions may deal with actual research problems. For example, what are the emotional and physiological correlates of genetic testing or genetic and molecular studies? Now, health psychologists not only do research and keep it to themselves, but they actually believe in putting this research into practice. And one area of practice is disseminating or imparting the knowledge that they have received from their research to other healthcare professionals such as doctors, nurses, physicians, and a host of other healthcare functionaries. The aim is to make the healthcare system and the process of healthcare a better experience for the patients. For instance, health psychologists may provide teaching and communication to doctors, nurses, and other healthcare professionals on how to encourage patients to prevent disease and promote health. For instance, how to have a better diet, how to stop maladaptive practices such as tobacco use or smoking or alcohol use. Or they may train doctors to increase their patterns of communication with the patients, or nurses on how to deal more empathetically with the patient, such as breaking the bad news of a diagnosis, especially when the diagnosis is severe, of explaining what kind of surgical and other invasive procedures they are going to undertake, and convincing them as to why it is necessary to go ahead with the procedure, and reassuring them of the best possible care and support. Also, this involves encouraging patients to comply with medical regimens and actually take a very positive outlook towards the process of recovery. Now, since health psychologists have such a solid research base of what the healthcare system comprises of, and they have a very good understanding of the different concepts and the different components of the healthcare system, they are better placed to influence health policy decisions, and they do so, and they advocate the formulation of certain health policies and the improvement of the healthcare system at various levels, at the local levels, at the state levels, at the national and even the international levels. And the best part is that health psychologists are today called upon before such policies are being framed. Now, another area where health psychologists deal is the critical analysis of the health policy. Now, a major theme of such a critical analysis of health policy involves raising the question of social justice in providing healthcare. Health psychologists have found that the quality of healthcare people receive differs according to their socioeconomic status, according to their nationality, according to the regions to which they belong, and a host of such factors. And here, health psychologists are not just passive researchers who bring out different kinds of findings, but they become active advocates, actively fighting and actively struggling for social justice in healthcare systems so that all sections of the population receive at least a satisfactory quality of healthcare. Thus, in this class, we have seen the significance of health psychology in a number of fields relating to physical health. For instance, the promotion and maintenance of health, the prevention of illness, the discovery of causation or etiology, the correlates of health such as diagnosis, treatment and recovery, as also the improvement of the healthcare system and the formulation of critical health policies for developing and enhancing the healthcare system. Finally, what we need to remember is that health psychologists do not aim to seize or usurp the rights of medicine. For instance, certain rights such as diagnosis or the prescription of medicines or drugs or the prescription of treatment regimens rightfully belongs to medicine, and health psychologists are not trying to interfere or intrude in any way in the process. Although in other fields of psychology such encroachments are being made. For instance, clinical psychologists in many countries are demanding the right to prescribe drugs on par with psychiatrists. However, as of now, health psychologists have not tried to interfere in the rights of medicine such as diagnosis, drug prescription and the prescription of other medical regimens. What health psychology and health psychologists significantly try to do is to just put forward that in the concept of physical health and disease, it is not just biomedical factors that play an important role, but an equal role is also played by a host of psychosocial, emotional and behavioral factors. And these factors play an important role both in the promotion of health, in the prevention of disease and in the entire process of the illness experience, right from diagnosis towards recovery. And hence, what health psychology is significant for is for its emphasis that unless we understand and give due respect to the various psychosocial correlates of health and illness, we can never get a comprehensive idea or a comprehensive view of what illness is or what the experience of health is.